Dengue fever is a mosquito-borne viral infection that significantly affects tropical and subtropical regions worldwide. The dengue virus, primarily transmitted by the Aedes aegypti mosquito, causes this illness. But how serious is dengue fever, and what can we do about it? Dengue fever, also known as breakbone fever, due to the severe pain it causes in muscles and joints, affects over 390 million people each year, with approximately 96 million displaying clinical symptoms. It's a disease caused by any one of 4 types of closely related dengue viruses. These viruses spread through the bites of infected mosquitoes, specifically the Aedes aegypti and Aedes albopictus species, which are most active during the day, particularly in the early morning and late afternoon. These mosquitoes breed in stagnant water, making urban areas with poor sanitation and water management highly susceptible. Consequently, dengue fever is a significant problem in many tropical and subtropical countries, especially in Southeast Asia, the Pacific Islands, the Caribbean, Africa, and Central and South America. Symptoms of dengue fever usually begin 4 to 10 days after being bitten by an infected mosquito and can last for up to a week. The initial signs include a high fever, which can spike suddenly and reach as high as 104 degrees Fahrenheit, 40 degrees Celsius. This fever is often accompanied by severe headache, typically described as intense pain behind the eyes. Additionally, patients experience joint and muscle pain, leading to the nickname breakbone fever. Gastrointestinal symptoms such as nausea and vomiting are common, along with a skin rash that may appear 2 to 5 days after the fever begins. Mild bleeding such as nosebleeds, gum bleeding, or easy bruising can also occur. In some cases, symptoms can escalate into severe dengue, also known as dengue hemorrhagic fever. This more dangerous form can lead to serious complications, including plasma leaking, fluid accumulation, respiratory distress, severe bleeding, or organ impairment. Severe dengue is life-threatening and requires hospitalization. It often occurs in individuals who have had a previous dengue infection, and symptoms include severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums, fatigue, restlessness, and blood in vomit. Immediate medical attention is crucial in these cases. Dengue fever can be classified into 4 types based on the virus serotype: Dengue 1, Dengue 2, Dengue 3, and Dengue 4. All 4 types can cause both dengue fever and severe dengue. Interestingly, infection with one serotype provides lifelong immunity to that specific type, but only short-term immunity to the other 3. This means someone can be infected with dengue more than once in their lifetime, with the risk of severe dengue increasing with subsequent infections. Prevention is the most effective measure against dengue fever, as there is no specific treatment for the disease. To avoid mosquito bites, it's essential to use insect repellent, wear long-sleeve shirts and long pants, and use mosquito nets while sleeping. Eliminating mosquito breeding sites is crucial. This involves getting rid of standing water in containers like buckets, flower pots, and old tires where mosquitoes can lay eggs. Using insecticide-treated mosquito nets and traps can help reduce mosquito populations. Community efforts such as local programs aimed at controlling mosquito populations and improving sanitation play a significant role in prevention. For those living in or traveling to areas with a high risk of dengue, staying informed and taking proactive measures can make a significant difference. If you experience any symptoms of dengue fever, seek medical attention promptly. Early detection and proper medical care can greatly reduce the risk of complications. In summary, dengue fever is a viral infection transmitted by Aedes mosquitoes, characterized by high fever, severe headache, joint and muscle pain, and a rash. It can escalate into severe dengue, which is potentially life-threatening. Prevention through mosquito control and personal protection measures is essential, and early medical intervention can save lives. Awareness and proactive measures are our best defenses against dengue fever, and together, we can reduce the impact of this disease and protect our communities.